Hi, I'm Professor Richard Mitchell. I am Professor of Health and Environment here at the University of Glasgow, and today we're going to talk about green space and equigenesis. So for a long time now, I've been studying the impacts of nature of green space on our health. We've spent a long time trying to work out whether green space is good for you, whether it's good for you to be in environments like this, and we're pretty sure now that it is. And so we're now developing our research further and thinking about its impact on health inequalities. That's the health gap that we see between more and less advantaged people. And the question we're asking is green space, is being in nature better for less advantaged people? So I spent a long time earlier in my career monitoring and mapping the health gap between more and less advantaged people. And it was incredibly depressing because we saw that gap never going away. And I got switched on to thinking about nature and health by someone from the Scottish Forestry Commission who came to me to talk about what they felt were the impacts of nature on health. And then I got really curious about whether nature could be something that actually worked to improve people's health and reduce those important health gaps. The government understands that places like this are an important resource for human health as well as for nature. And so we've seen much more attention on the provision and protection of spaces like this. We're also seeing impacts in the use of spaces like this for therapy. So for example, bringing people who have very poor mental health out into spaces like this, sometimes to work, sometimes just to sit and look, and we see positive impacts on their health. And we're also starting to think about how we can work with lab scientists to understand the mechanisms by which green space might influence health at a molecular level, actually what's going on inside your cells. And particularly for me, I want to ask that question, are these mechanisms, are they different? Do they work more effectively on different kinds of people? Okay, so there's lots of different kinds of science going on right across the college, from people who work on what goes on inside your cells, or what we call molecular level, right up to people who study the health of millions of people at once. My research seeks in some ways to kind of bridge some of these approaches. So I have done lots of work where we look at the distribution of health in the population. Who is it that tends to be sicker? Who is it that tends to be healthier? What I'm starting to do now is to work with people who work in laboratories or conduct experiments to try to use the techniques they have to answer some of the questions that I have. So one of the things I'm really curious about is, how is it that green space actually affects your health? How does it get under the skin? And so I can work with people who are used to conducting experiments, sometimes in laboratories or sometimes outside, to learn from them about how we can prove that green space affects health and to understand what the mechanisms are. So yeah, I would really recommend MBS and the University of Glasgow as a whole right now. It's such an exciting moment because we've got a combination of ambition from the university's leadership and investment. So it's a great time to come and work with us because we're very well resourced, we're incredibly lucky, and there's just an incredible range of talented people who are wanting to work together to push forward the boundaries of the science that we do.